Today, we're mixing things up a bit. Well, usually we focus on women's voices. It's important to remember the men in our lives too. So, in the spirit of taking care of our guys, especially as we wrap up Movember, I'm excited to have Ludovic Brunel, ND, join me on behalf of New Roots Herbal. We're going to chat about something that doesn't get enough attention: prostate health. It's a topic that's crucial for men, and as women, we play a big role in supporting their health journey. Welcome to What She Said, Ludovic.
Thank you. It's my pleasure to be on the show.
So let's dive right in. Can you explain the role of the prostate gland in men's health?
For sure, the prostate gland plays a key role in reproduction. Basically, it produces a liquid that comes out with ejaculate, and it helps sperm survive and get to where it needs to go or where they need to go to fertilize the egg, essentially. So, very important for the male reproductive system.
And BPH, or benign prostatic hyperplasia, if I said that correctly,
Correct, yes.
is a term that many might not be familiar with. So, can you shed some light on what it is and how it impacts the prostate?
For sure. It's one of the most common problems we see associated with the prostate. Although the name is a mouthful, BPH, basically, the name says it, the prostate gets bigger, hyperplasia. Essentially, what happens is that as men age, the cells within the prostate start to multiply. And that's what we call hyperplasia. And the cells in the prostate gland don't necessarily become larger, but there's more and more cells that accumulate. You can think of it like too many marbles inside of a balloon. So eventually the balloon starts to expand and stretch. This growth of the prostate means that the prostate can change in size, obviously. And for men in their 20s, usually the prostate is about the size of a walnut, but it starts to grow. And in the 40s, it's usually about the size of an apricot. And then in the 60s and onwards, as large as a kiwi. And of course, it can get much worse. And that's usually when we'll start to see some symptoms.
And well, actually, that's a perfect segue into my next question. So, what are some of the telltale signs that might indicate a man is dealing with an enlarged prostate, and how can it affect sort of his everyday life?
Yeah, so the effect can be profound if the prostate grows significantly. Basically, it starts to expand in all directions. So it presses on structures that are just outside of it. And because it sits right below the bladder, it'll push up on the bladder. Through the prostate is the urethra. So the urethra is the tube basically that we use to empty our bladder. And so if it starts to compress on that, then it starts to affect the urethra and flow through the urethra. So the most common symptoms we typically see are increased frequency of urination because the prostate pushes on the bladder. It creates this pool. So it's very hard to empty the bladder fully. There's a weaker stream because the urethra is getting compressed. Urine doesn't flow out the way it used to or the way it should. And of course, if the bladder doesn't empty properly, because some urine stays in the bladder, it really increases the risk of urinary tract infections. And of course, one of the key symptoms and one of the ones that often brings men in and drives them to seek help is waking up often at night to use the bathroom. And of course, that leads to poor sleep and poor quality of life, fatigue, and it's also often a huge disturbance for the partner as well, right? It can rival snoring as a factor for sleep deprivation. The other thing to know is it's very, very common. The latest statistics from Statistics Canada show that there's about 3.7 million men that currently suffer from BPH in Canada.
Wow. As you mentioned, getting up in the middle of the night, and I think this is where the ladies are going to really tune into this. So,
For sure.
if someone is showing those symptoms like a weak urine stream or frequent trips to the bathroom, what should their next steps be, and how crucial is it to distinguish these symptoms from those of prostate cancer?
So that's the key thing, obviously, because BPH, the prostate is growing. We also need to know if the symptoms are associated with benign growth, right? So and prostate cancer, where we would have very similar, if not exactly the same symptoms. And so typically, as soon as some of those symptoms are present, we want to start looking at additional testing for the prostate. One of the key tests to look at is called the prostate specific antigen, which basically tells us how big the prostate is. And it's a simple blood test. So that would be one of the things to do to rule out cancer.
So, when it comes to treating BPH, then what are the usual routes to take? And are there any side effects that men should be aware of if they're pursuing these treatments?
Yeah, so in terms of the conventional Western care, there's two prescription drugs that are basically recommended or used in those types of conditions. One is a muscle relaxer, and the other one inhibits the action of an enzyme that basically um, makes testosterone more potent, and testosterone causes growth of prostate cells. So we block that enzyme. Those medications, though, affect hormones, and because they affect the hormones, their product monographs clearly shows that there can be significant side effects, and a lot of men will experience these, especially when they first start the medication, and they include decrease in libido, erectile dysfunction. It can also affect mood and lead to problems like depression and anxiety.
What about prevention then? Are there ways to prevent? I mean, it sounds like this happens naturally over time, but are there ways to prevent it from becoming problematic in your life? Are there supplements and things like that that people can take to help?
For sure, there's supplements that are effective both at preventing the excessive growth of the prostate, but also that have been shown to be effective if someone suffers from symptoms of BPH. Probably the most well known is saw palmetto extract. And we know that the fat in the saw palmetto plant improves urinary tract symptoms in several ways. They have an action via hormones, and they also decrease inflammation. Some of their benefits are very similar to what we observe with prescription drugs for the treatment of BPH. Other potential supplements that have been shown to be helpful, there's a pollen extract from rye, so rye flower pollen. In clinical studies, has been shown to decrease nocturia, so getting up the frequency of nighttime urination, and also during the day, similar effect. There's also plant sterols, beta sitosterol being one of them. They're potent anti-inflammatory compounds, and they also play a role on hormones, especially the balance of androgens, and so those can also be very helpful.
You mentioned anti-inflammatories, and I'm curious, how much of an impact can diet have on prostate health?
Well, as for anything really, the prostate benefits from a healthy diet. Some of the key things that we know help to promote overall health, but also the health of the prostate. Eating well, meaning lots of vegetables, not too much processed food. Maintaining a healthy weight is really important when it comes to the prostate. Regular exercise, not smoking, obviously avoiding tobacco products, and then alcohol is also problematic if it's overconsumed.
All right, wonderful. Ludovic, it's been great having you on the show. Where can people find you?
They can find me through my website, drludobrunel.com. And yeah, so that would be probably the easiest way.
All right, wonderful. Thank you so much for shedding light on a topic that's so important for the men in our lives. And to my listeners, remember, taking care of your health and the health of your loved ones is key. If you or someone you know is experiencing any of the symptoms, don't hesitate to seek medical advice. And for those interested in natural solutions, check out New Roots Herbal's Prostate Perform at your local health food store. Thank you again, Ludovic, for joining me today on What She Said.
Thank you. The pleasure was mine.